on the behalf of IDP, I welcome Dr. GN Purohit. I want to just give a brief introduction. Dr. Purohit is a university gold medalist and a renowned researcher, which is having a more than 35 years of the experience. He has a 221 research publications and 54 YouTube lectures, and he is hosting a YouTube channel which has a more than 3,500 subscribers over many countries. He is working as an associate editor to many journals, international journals, national journals. He has received many awards and guided more than 23 MBSc students and 4 PhD students. And he has produced the Rajasthan state's first embryo transfer calf and lamb. And he has a great exposure on the management, reproductive management, and herd health management in case of the camels. Now I hand over the mic to Dr. Purohit. That's up to you, sir.
So thank you very much, Dr. Bilawal. Am I audible?
Yes, sir. Yes, sir. You are
okay,
audible.
Okay. So at the outset, let me extend my sincere thanks to the organizers, Professor Prahlad, Dr. Ghumman, and Dr. Bilawal, for providing me this opportunity to interact something on the reproductive health management of camels. In fact, camel health management, actually reproductive health management, I have only little of experience about it. ਤੇ ਸਾਰੇ ਸੁਣਨ ਵਾਲੇ ਭਰਾਵਾਂ ਤੇ ਭੈਣਾਂ ਨੂੰ ਸਾਡਾ ਜੋ ਹੈ ਸਤਿ ਸ੍ਰੀ ਅਕਾਲ। ਤੁਹਾਡਾ ਇਸ
all are the UG students, sir. UG students, okay. PG students, and internship students.
Okay. So let us now start talking something about the reproductive health management of camels. You see, camel is a very special species, and camels are kept for milk production in Africa and Asia, and the global camel population is estimated at 35 million. In the sub-Saharan Africa, camels contribute about 5% of the total milk production. And Somalia is by far the largest camel milk producer of the world, followed by Kenya and Mali. Now, camel raising is something different at different places. Camels are raised in Gulf countries for the racing events, mainly for the racing events, although the Gulf people, they relish to have the camel milk, but basically they are raised for the racing events. In the Indian subcontinent, camels are raised for agriculture, transport, and a source of milk. I'm showing these pictures to let you know about the diverse use of camel in the Africa. Camels are used by people for transport, for bringing in water, for bringing in food. And this picture is a picture from the Dubai racecourse event, and the camels are participating in the racing events. And for the prince and for other hierarchy of people, their camel winning a race is a pride for them. Then here are the two pictures of our place, Bikaner, of the camel festival. The first one showing the Robile of Rajasthan, and the second one showing a camel dancing. Now, camel population is on the decline. In India, it has declined from 4 lakh in 2012 to just 2.5 lakh in 2019.
Excuse me, sir.
Yes.
Sir, slides are not visible.
Not visible. Should I switch over to, instead of the PowerPoint, should I switch over to PDF? Let me try it once again. Are they visible now?
No, sir.
No.
No, sir.
Let me try once again.
Yes, sir. Now it's visible.
Now it's visible. So should
Yeah.
I continue?
Yes, sir.
Okay. Okay. Thank you. So the camel population, is it visible?
Yes,
it-
sir. Visible. Yes, sir.
Okay. Okay. So the camel population is on the decline. In Rajasthan alone, in 2012, the camel population was 3.26 lakhs, and in 2019, it has declined to 2.13 lakh, 34.69% decrease. This is a subtle decrease. And in Gujarat, a minor decrease was there. In 2012, the camel population was 30,000. It has declined to 28,000. In Haryana also, it has declined. The camel breeding, the interest of camel breeders in particular, is declining maybe due to one or other reason. Now, camels, they have been classically classified into the New World camelids and the Old World camelids. The Old World camelids include the dromedary camel and the Bactrian camel and the wild Bactrian camel found in Australia. And the New World camelids include the guanaco, the llama, the alpaca, and the vicuna. So here are two of the most common camels, the dromedary camel, which is found basically in the Gulf countries, and also known as the Arabian camel or the dromedary camel. And India harbors most of these camels. There are a few Bactrian camels also in Ladakh area in India, but basically these camels, Bactrian camels, they are found in South Asia, especially China, Mongolia, and these countries. And these are some of the wild Bactrian camels found in Australia. These pictures show the South American camelids, the llama, the alpaca, the vicuna, and the guanaco. Now, breeding seasons in camels. Camel is a seasonal breeder, and the breeding seasons, they vary from during the winters in Egypt, they vary from December to May. In India, from November to March. In Pakistan, December to March. Kenya, they say there is a continuous breeding season. And in most other countries, the breeding season varies from December to March generally. But in Somalia, there are two seasons, May to June and October to December. Now, the peculiarity of the camel reproduction I need to discuss first, and then we will be talking something about the other reproductive management events for the dromedary camel. The camel ovaries, they are dorsoventrally flattened in adults, slightly convex in the camel heifers. They are suspended by the mesovarium and enclosed in an ovarian bursa and located on the pelvis or just ahead of it. They weigh 2 to 5 grams. The length maybe 2.5 to 6 centimeters. Now, the location of the camel ovaries in proximity to the ovarian bursa is very important, because this is the place where fluid accumulations frequently occur in camels, and they confuse the practicing vet or the uh, clinician with the fluids of early pregnancy. Then the uterus of the camel, it is bicornuate, it is T or Y shaped. The left uterine horn is longer as compared to the right uterine horn. Some of the workers, they say that in heifers, camel heifers, the uterine horn are not that differently larger, but in adult camels, the left uterine horn is exceptionally longer compared to the right uterine horn. This is probably because pregnancy exclusively occurs in the left uterine horn in the camel. Even if there is an ovulation in the right ovary and the embryo descends in the right uterine horn, it migrates to the left uterine horn to be established in the form of pregnancy. So this is very peculiar about the camel. The uterine horns are present at the brim of the pelvic cavity, and they can be easily palpated by transrectal palpation uh, for a camel which is in a sitting position. And transrectal palpation, people who have done palpation of cattle, buffalo, I think it will not be difficult for them to locate the camel uterus and just differentiate the uterine horn. Then, as I said earlier, some workers say in camel heifers, the uterine horn is not different in size. The cervix of the female camel is soft with 3 or 4 longitudinal folds, and consistency of the cervix does not differ with that of the uterus. So, as for the equine species, that it's difficult to uh, differentiate the os externus or the cervix in the equine species. It's also really sometimes difficult to differentiate the cervix from the uterus in the female camel by transrectal palpation. The cervix projects caudally in the vaginal cavity, forming a fornix 1 to 1.5 centimeter, and the external cervical orifice is surrounded by 1 to 2 circular indented rings of the cranial part of the mucosa of the vagina. Here you can see. Then the oviduct of the female camel is long and tortuous. The uterine and isthmus is well developed, and it's 17 to 22 centimeter long. The vagina of the female camel is long, 30 centimeter, and have 2 vestibular glands on the lateral walls. The vagina has many longitudinal folds. The anterior vagina and the vestibulum are separated by a strong band of tissue, the vestibulum sphincter muscle, and the hymen, which is very tight in young and nulliparous females. Many a times when a camel heifer, it is served by a adult dromedary uh, male camel. Sometimes the hymenal rupture, it leads to bleeding post service. The vulva opens directly below the anus and measures 6 to 7 centimeter in length. The clitoris is very small, and there is no distinct clitoral fossa. The urethra is also short, and the opening of the urinary meatus is small. The hymen or its remnants mark the separation between the vulva and the vagina. Here you can see the uh, vulva of a female camel. And in some of the camels, you can find that the vulvar lips, they are dark colored. Uh, rather deep brown to sometimes even black in color, and this may be due to the pigments that are present. Now we talk something about the reproductive physiology of the female camels. Now, very important thing is that it is very difficult to describe a estrus cycle as it can be defined in other animals. Estrus cycle is difficult to be defined in camels. The cervical mucus is scanty and less viscous, and other signs of estrus are less marked. The camel breeders, they think that during the breeding season, whenever you give a mating with a male camel, the female camel will conceive. This concept probably arose because of some of the physiologic features which we'll be discussing later. But this is not always true. It's not always true. The camels are seasonally polyestrous, and puberty, it occurs at 4 to 5 years and around 400 kg weight in females. As far as the follicular dynamics are concerned, follicular growth occurs during the breeding season. You can see here the camel ovary, it is showing some of the follicles growing on the ovarian surface, and one can very easily perform transrectal ultrasound in the camel by placing the probe inside the rectum, and one can locate the ovaries and then visualize the structures that are present on the camel ovaries. The follicular growth occurs during the breeding season. There are reports that some follicular growth may occur even during the non-breeding season. And camels sometimes, when bred during the non-breeding season, they can conceive. Now, follicular dynamics, follicular growth is continuous during the breeding season and in the absence of a mating. You see, camel is a induced ovulator. Ovulation occurs only in response to a mating. The what happens is ovulation depends on mating. If there is no mating, ovulation will not occur, and there will be no luteal phase in non-mated camels. Because ovulation will not occur, ACL will not form, and so there will be no luteal phase as it occurs in other species, that once ovulation has occurred, there will be formation of a corpus luteum, which will function, which will continue to function for the period of the cycle. In mated, mated but non-pregnant camels, the luteal phase is short, 6 to 9 days. So this is where which creates confusion. The camel has been mated, and if it does not conceive, the luteal phase is very short, 6 to 9 days only, and there will again be follicular growth. Follicular activity continues in the presence of an active CL. Now, this is something very peculiar about the camel. Although a active CL is present, the follicular activity will continue. And reports, they mentioned that follicular recruitment, it requires 2 to 4 days, growth 10 to 12 days, and dominance occurs at 6 millimeter of diameter. Now, one thing which is very special about the camels is minimum follicle size to ovulate. A follicle which becomes able to be ovulated would be 9 to 10 mm. And the size diametrics of some of the reports, they say that sometimes a follicle beyond 2.5 centimeter or 2 centimeter may or may not ovulate. So this is very peculiar about the female camel. Then the fate of dominant follicle in the absence of a mating. What will happen if there is no mating and a follicle grows and becomes a dominant. But what will be its fate? Its fate would be an ovulated follicle, which may persist, which may uh, lead to hemorrhage within the follicle. It may persist for many days or regress in 4 to 18 days. You see, the follicular growth can occur in the presence of a unovulated follicle. If there is a large unovulated follicle, still the follicular growth will continue. Now, the unovulated follicle may either continue as hemorrhagic follicle sometimes. So this poses a problem when when one attempts to collect oocytes from the ovaries of dead camels, because if you attempt to collect oocytes from such follicles, plenty of RBCs will be there in the medium, and one will not be able to just visualize the oocytes. Then, in mated camels, the uh, LH surge will occur in response to a mating, and there will be an ovulation. There will be an ovulation. Again, the progesterone will start rising, but then it will be maintained for 6 to 9 days, and then again it will regress. The prostaglandin F2 alpha will be released, and the CL that has been formed in mated camels without pregnancy would be lysed, and again the female camel will have a follicle, and when again mated, the uh, follicle will ovulate. Now, we talk something about the reproductive behavior in camels, female camels. Female camel in estrus would chase other females. It would clearly show receptivity towards a male. And then there will be restlessness and bleating, up and down movement of the tail on approach of a male, and sometimes female in estrus may smell other females also. Then when the male approaches, the female camel raises her tail and may sit down for a mating. So these are some of the reproductive behavior of the female camel shown towards a male camel. It will sit down and then mating can occur. The female camel, it has got the mammary glands and 4 teats in the udder, which develop during the terminal stages of gestation. Then mating in camels continues from 6 to 12 minutes. And as I said earlier, a female will sit for the male to provide a service. The male may bite the female, and the female may bite the male either. And then the male camel will sit down and then give a service. The female camel may bite the male during or after the service. So this is how the mating is performed by the male camel. It mounts over the female camel, and then it provides this service in a sitting position. These are again the pictures of the female camel biting the male during the service. Now, ovulation in the female camel is mating induced. Ovulation occurred 24 to 38 hours later if the size of the follicle is between 8 to 20 mm. Now, some of the earlier workers, they thought that it's simply a mechanical stimulation which leads to the release of luteinizing hormone. Later, some of the Chinese workers, they gave some data that the ovulation induction agent is present in the seminal plasma, and if simply seminal plasma is either infused or maybe it is injected, it can cause ovulation. But later works, they found that it's not only some agents in the seminal plasma. It is a complex mechanism involving the physical stimulation, involving some of the agents present in the seminal plasma, some of the agents which might be secreted by the female camel, the nerve growth factors, and maybe there are still many other uh, molecules which may be involved, some of which are yet to be known. Then large anovulated follicles may sometimes not ovulate in response to emitting. As I said earlier, a follicle beyond 25 centimeter is less likely to ovulate in response to a mating with a camel. But mating is essential for induction of ovulation. Ovulation can also be induced by administration of human chorionic gonadotrophin, but the results of administration of buserelin acetate, GnRH, are suboptimal. And the large anovulated follicles may, on ultrasound examination, may show specks of tissue, white echogenic structures, uh, which may be visible. Then the follicle grows to ovulatory size in 6 days. And finally, if there is a mating, then there will be ovulation. The cyclic CL, as it is seen in cattle, is absent in non-mated camels. As I said earlier, a CL will not be formed in non-mated camels. And CL formation occurs 24 to 48 hours after mating, with slow development and early death in the mated camels. So there is difference in the formation of the corpus luteum in the mated and the non-mated camels. The regression would occur 8 to 12 days following infertile mating. But if there is a fertile mating, maybe the pregnancy may continue and there will be non-release of the prostaglandin for the luteolysis. The embryo descends in the uterus at day 6 to 7 of mating, and embryo elongates remarkably at day 9 to 10. So this sometimes poses a problem for people working in embryo transfer, because if there is a delay in recovery of the embryo, sometimes one can find very elongated structures and it will be difficult to just identify them that they are the embryos. Then maternal recognition of pregnancy, little is known. Probably the signal must be secreted by day 8, but it's not very clearly known what is the signal for maternal recognition of pregnancy. Is it interferon or it is something else? It's not known clearly. Then, as I said earlier, there is exclusive left uterine horn pregnancy. So there will be migration of embryos day 15 to 18 post breeding. The mechanism of known clearly possibly occurs by day 20.
Sir, what would be the for possible pregnancy diagnosis?
Yeah,
Would it
we'll
be
be
the
coming. We'll be coming to. We will be coming to. The mechanism of luteolysis is poorly known. And then there is difference in the luteolytic properties of the prostaglandin from the left and the right uterine horn. The prostaglandin released from the left uterine horn will be luteolytic for CL present either on the right ovary or the left ovary, but the prostaglandin released from the right uterine horn will only be luteolytic for the CL present on the right ovary only. Now, the reason for such a discrepancy are very, very poorly known. Then pregnancy and its diagnosis. The gestation period in the camel extends from 390 plus minus 10 days. Some reports say 380 to 420 days, but the average gestation period is thought to be around 390 days. The pregnancy diagnosis in camels can be performed by transrectal palpation, transrectal ultrasonography, and visual observations of cocking of the tail. Now, this is very, very peculiar feature of the female camels. A female camel, when it becomes pregnant, and the last one is plasma progesterone assay. The female camel, when it becomes pregnant, it will show the lifting and curving of her tail, which is called as the tail cocking, or it is in some of the literature, it is also written as the Bidui sign of pregnancy. And sometimes a female camel that is pregnant, when the handler approaches it, again it will show cocking of her tail. Upward curling of the tail when the male approaches her, and it will not allow the male to give a mating. When it is first seen at 20 days of gestation and persists throughout the gestation. Some of the reports, they say that the cocking of the tail may persist, may be seen as early as day 14, but generally it is seen after 20 days of a fertile mating. Now, this sign of cocking of the tail may be sometimes misleading. Although we have not seen cases here in India, but in the Gulf countries, there are a lot of cases. They maybe because those camels, they are raised in a different manner, and maybe because they are fed some of the estrogenic feeds. Camels having ovarian cyst, sometimes they continuously show the cocking of the tail, and this confuses the breeder and sometimes even the vet. So this sign would not be reliable very accurately if a camel is having a cyst on the ovary, particularly a progesterone producing cyst. It is a common practice in camel breeders in UAE and other Gulf countries also, that they, as soon as the camel shows a cocking of her tail, they will collect a blood sample, send it to the lab for the progesterone assay. Camels showing progesterone, plasma progesterone about 3 nanogram per ml, they consider those camels to be pregnant. But they repeat this after 15 days, or maybe some people have their own approach. They repeat it after 30 days, and if the progesterone is still higher, they consider, yes, now the camel is pregnant. But this may be sometime. Even I have examined a few of the camels wherein they were having ovarian cyst, and they were showing continuously the cocking of the tail and the higher plasma progesterone as well. So this should be kept in mind. But under the Indian conditions, I have seen very rarely a camels developing ovarian cysts. Then the abdominal size would increase as the female camels is advanced pregnant, and transrectal palpation can be performed in camels in a sitting position. The Indian camels, they are very hard to control, so they have to be restrained in a sitting position, tie the hind legs and the forelegs separately with ropes, and then in a sitting position, sometimes even they would require the administration of xylazine, 0.5 to 2 milligram per kg intravenously. Some of the camels, they will require a very large dose of xylazine without effect. Once you administer xylazine, there will be loss of lower lip tone, and then camel can be examined. But I was thinking that how a camel can be examined in a standing position. But when I visited one of the camel farms of a breeder in UAE, then I found, yes, those camels are slightly smaller in size as compared to our camels. And they have made some specialized traverses in which you can examine the camel in a standing position. It is always a better approach to examine a camel in a standing approach. But after administration of xylazine, and you can have a platform put underneath for the examiner so that he can have some height for examining. But under our situations, mostly we will have to use this type because our camels are larger in size as compared to camels in the Gulf countries, because they are basically uh, raised for the racing events. Then transrectal ultrasonography, again it can be performed in a camel restrained in a sitting position, and both the hind legs and the forelegs, they are tied separately. And this is one of our student, Dr. Sandeep, who did his MBSc and PhD work both on camel reproduction. And one can uh, insert his hand inside the rectum. It's not very difficult to examine the ovaries as well as the uterus of the camel, especially during early gestation and during in non-pregnant camels. In during advanced pregnancy, maybe one's hand cannot go much more deeper inside. There are also reports from other places of examining the gestation through trans abdominal ultrasound, but I I have nothing to comment on that because I have no experience on using trans abdominal ultrasound, especially in camels. Then some of the reports, they mentioned the identification of some molecules in camel, but their work is still uh, preliminary, and hopefully we will have more and more research carried out on these aspects and more molecules available for but for the camel breeders, cocking of the tail, they think this is one of the surest sign, and many a times they are correct also, not always incorrect. Then ultrasonography, transrectal ultrasonography, one can visualize the embryo on day 10. The embryo is elongated about 4 mm in length at this time, and on day 12 it elongates to 20 mm in length. At 35 days of pregnancy, the fetus can be scanned and the extremities of the fetus can be uh, visualized. Now it's I was one day just comparing the appearance of the heartbeats in different domestic animals, and to my surprise, I found that in most of the domestic animal species, irrespective of their gestation length, except the horse, in which it appears earlier, the fetal heartbeats, they appear from between day 20 to 24 in most domestic animals. And this was very surprising for me to find that a camel having a gestation length of 13 months and a bitch having a gestation length of 62 days, the fetal heartbeats appear at a nearly similar time. I don't know what could be the reason, but this was very special for me. Then as I said earlier, there is exclusive left uterine heart pregnancy. Pregnancy establishes only and only in the left uterine heart. Now, the reasons for these are poorly understood, and only this much is known, that the embryo migrates. But why does it migrate? Not very clearly known. Twins are rare in camel, and then there is presence of a extrafetal membrane, which is known as the epidermal membrane, is 1 to 2 millimeter thick, attached to the fetus at the hips, at the nostrils, anus, vulva, prepuce, footpad, and umbilicus. This epidermal membrane, the exact function is not very clearly known, but it is presumed that it acts as a shock absorber for the fetus. But the actual uh, function of this epidermal extrafetal membrane in the female camel is not very clearly known. Then this is a picture of a fraternal dromedary twins. Twins are rare in the camel, and this is one which we observed in a nearby village of Bikaner, and we reported in the Journal of Camel Practice and Research in 1999. But thereafter, there had been reports of twins in camels produced by bisection of the embryos by Alex Tinson and his team. And there are some other reports also on the intentional production of the twins in the female camel. Now, now we talk about the male camel. You see, the male camel is also having some peculiar reproductive behavior. And before we talk of the behavior, we talk of the anatomy of the male camel. The testes and the scrotum. The scrotum lies high in the perineal region. Here you can see it's lying high in the perineal region. The testicles are oval in shape and lie obliquely. They are lying obliquely. The right testicle is slightly bigger than the left testicle. The testicle length is 7 to 10 centimeter, weight from around 90 gram. The testicles, they become more protruded outside during the breeding season. They enlarge during the breeding season, and peculiarly, they are more visible from the side also. You can see this male camel, the testicle has enlarged, and now it's visible from the side view also. The camel has a prescrotal sigmoid flexor regarding the copulatory organ. The penis, again, is the penis of the camel, which is a center of attraction of many tourists at the National Research Center on Camel at Bikaner, because they think the penis is oriented backwards. How then the male camel performs the mating? We will come to it. The penis is fibroelastic and about 60 centimeter long. It is directed backwards when flaccid. The spiral glans penis is curved, giving it a hook shape. Externally, the penis is covered by a triangular shaped sheath, the prepuce, which opens to the rear. Externally, the penis is covered by the male camel urinates toward the rear between the hind legs. Now, you can see in these pictures, a camel urinates towards the back side, towards the tail side. The penis or the prepuce is oriented towards the back side when it is flaccid, and so when the camel will urinate, the urine will come between the hind legs towards the tail. But during mating, when the camel will set, this muscle will relax and the prepuce will be oriented forwards. Due to presence of a well-developed lateral preputial muscle in addition to the cranial and caudal muscle, the preputial orifice can be directed either cranially or caudally during erection and micturition. So this is how you see I have tried to show it in this picture. This was oriented backwards, and then this has oriented forward during the mating when the camel sits and the penis protrudes out. Then male camels have prostate glands and bulbourethral glands, but seminal vesicles are absent. This is again very astonishing for me, that the stallion and the boar, they have a gel. Now their semen has a gel, and this a greater part of the gel originates from the seminal vesicles. But camel semen also has a thick gel, more thicker than the stallion or the boar semen. But there are no seminal vesicles. Then where from it originates? That's still not very clearly known. Then camels have a rutting behavior during the breeding season. This is known as the rut or the must of the male camels. The male camels evidence special behavior called the rut. The male camels become somewhat aggressive during the breeding season. You see, during the non-breeding season, most of the male camels are not very aggressive, but during the breeding season, they sometimes become aggressive. And these are some of the peculiar signs shown by the male camel: sniffing, phlegm, grinding of the teeth, whistling, gurgling sounds, urinating, open hind legs, tail flapping or beating, and then there is a pole gland secretion. The soft palate, or what is known as the dulla, it protrudes out from the mouth, and male camels also lose weight during the breeding season. You see in these pictures, this is the extrusion of the soft palate, what is also known as the dulla or the gulla, and then urinating, the hind legs apart, urinating, tail flapping, and then there is plenty and plenty of froth which comes out from the mouth of the male camel during the breeding season or during the rutting season. Here also you can see this camel having plenty of froth, plenty of secretions from the mouth, and then camels produce a peculiar gurgling sound during the breeding season. Then these are the pole glands located just behind the ears, and they secrete black colored, dark brown or black colored secretions, which probably contains androgens. And some of the people, they say that they are also having a pheromone like action. But these pole gland secretions are very scanty during the non-breeding season. During the breeding season, there's very high secretions from the pole glands. So this is very peculiar about the male camel. So male camel is also having the breeding season behavioral and other changes. You see, this was a camel before the breeding season, and you look at it during the breeding season, it has lost a lot of weight, and the muscles, the ribs have become clearly visible from a distance. So the camels, they lose weight during the breeding season, extrude their dulla, extrude their soft palate, create a particular sound. There is a pole gland secretion, and then there is plenty of froth coming out from the mouth, and they become vicious also during the breeding season. Then this is the peculiar phlegm response shown by the male camels during the breeding season. So now, friends, we talk of some other things. The reproductive biotechnologies, AI and ET, are being utilized extensively to improve the production characteristics of various domestic animal species. These techniques are not well developed and thus are not being used as a routine breeding procedure in camels. Why? We come to that. That even using cryopreserved semen, the success of AI is still very, 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 very low in the female, in the camel species. Now, why it is so? Reproduction in the camel is unique. It's a seasonal breeder. The breeding season is a short 3 to 4 months, coinciding with the short days. And the male has a more pronounced effect of the breeding season. Then the female camel is induced ovulator. Only in response to a mating, ovulation will occur. And there is a lack of clear estrous cycle. So when to inseminate a camel? Then hormonal treatment to induce ovulation and control the follicular cycles using GnRH is inconsistent. GnRH does not really induce the desired effects as they are observed in cattle or buffalo. Then there is one more reason. There is a very, very thick gel in the camel semen. And when one collects the semen, immediately after that, it's difficult to see anything. This gelatinous matrix, it just prevents the visualization of the mass activity in the camel semen. And once you want to see the spermatozoa, you will have to keep the camel semen for maybe for 4 to sometimes even 8 hours for the gel to liquefy at room temperature. Once the gel is liquefied, then this one can examine the spermatozoa. Otherwise, it's not possible. I don't know, but I think like that. It is some mechanism given by nature for the camel species. Then, because of the thick gel, it's difficult to cryopreserve the camel semen. And some trials were conducted by one of our students on the use of enzymes for earlier liquefaction of the uh, gel of the camel semen. And some of the results were promising, but not to that extent that they can be very widely suggested for use of artificial insemination in camel. Then the trait, another important factor is the trait is lowly measurable. You see, camels, the major trait would be draft, and it's measurable with difficulty. So again, once you don't have a identified trait, it becomes difficult to propagate a particular male. Then artificial insemination in camel semen collection can be done in sitting position using different methods, using different types of artificial vaginas, electroejaculation, and the uh, female camel or artificial dummy for mounting of the male. The artificial vagina used for the bull semen, for collection of the bull semen, is used for camels, and uh, uh, the artificial vagina with rubber liners similar to bull is used for collecting semen from male camels in a sitting position. Now, semen collection in camel, uh, it can be collected this way. The penis is directed into the artificial vagina, and the male would, on ejaculation, the semen is collected and brought to the laboratory. But you see, this is the picture. You take the semen in a syringe, and it has a very, very, very highly viscous. It will not drop down. So this particular gel in the semen prevents the dilution, prevents the examination of the semen, and this gel creates a lot of difficulty for artificial handling of the semen for artificial insemination and sometimes even dilution. Then camel semen extension, liquid semen is extended at 5 degrees centigrade, and tris yolk citrate was better than lactose PBS citrate buffer. There were reports of using the ready-made lacifos used for bovine semen, for camel semen, but again, these reports did not mention the conception rates using such diluters. Then successful insemination using 3 to 5,000 human chorionic gonadotrophin, and you see, because the animal is an induced ovulator, so you will have to uh, uh, either use one or two of these approaches. Either you use a HCG maybe before mating or immediately after mating. Or some people, they suggest that you perform an AI and then use a vasectomized male for mating. Using liquid semen, pregnancies have been achieved, but cryopreservation is still not a very reality for the camel semen. Tris yolk citrate glucose, it resulted into good post-harm mortality, but no pregnancy. Uh, Again, there are very few reports on using the cryopreserved semen for camel and attaining a pregnancy and a live birth. So this particular problem of camel need to be addressed before AI can be. The physiological problems are a barrier also, and so I think camel AI is not very popular. Then embryo transfer in camel. In the Arab world, there were reports of Professor Yagil, Skidmore, Mackinnon, Enozi, Vani, and Nagy. All these reports have mentioned the production of calves and by embryo transfer in camel. And nowadays, in many Gulf countries and many other countries also, because of the racing event, the embryo transfer is becoming popular, and the uh, animal owners or maybe the kings are desirous of embryo transfer of a female which has won one of the prestigious race, and so it is becoming slightly popular. In India, Dr. Sumant Vyas at the NRC on camel, he produced the first embryo transfer calf in camel. Then again, the superovulatory protocols, a wide variety of ovulatory protocols have been suggested. But the problem is that you cannot start the regime as you start in cattle. The donors, they will have to be induced to a luteal phase. So on day 0, a HCG is given, and from day 6 to 8, the superovulatory regime is started using 8 to 10 days, 8 to 10 doses, and mating is performed at 36, 48, and 60 hours after the last follicle stimulating hormone. For the recipients, day 13 to 14, a HCG is given. Then non-surgical embryo flushing can be performed in camel day 7 or 8 after first mating. The flushing is performed in a sitting posture on an inclined plane, and 18 gauge 63 centimeter flexible two-way Foley balloon catheter, which is used for equine species, can be used for the camel species. Both uterine horns are flushed simultaneously, or maybe they can be flushed individually, and using 1 to 2 liters of Telbacco's phosphate buffered saline. Then embryos can be transferred in a sitting posture the same day using the embryo transfer gun and guided with hands or finger through annular folds of the cervix. One has to place his hand inside the cervix, place his hand inside the vagina, and through another hand, he will have to guide the a gun to be going inside the uterus. And again, it has to be deposited only in the left uterine horn. It should not be deposited in the right uterine horn, because pregnancy is ultimately going to happen in the left uterine horn only in the camel. Then some of the common reproductive disorders, you see, camel herds have shrinked, and the reproductive disorders noticed by the, or some problems emanating for the breeders can be investigated by the vet only when the breeder comes to the vet. And there were a few camel herds in Rajasthan also, in Bikaner also, there were a lot of camel herds. The Raikas, they were keeping the male and the female camels, migrating their camels to long distances, and then they were selling the calves or the camel itself to the breeders. Due to increased use of mechanization, this has shrinked. And probably, I think it is going to shrink further. Now, in some of the countries, Gulf countries, and even some South African countries, or maybe other countries, they keep very large herds of camels, and maybe they are noticing some of the reproductive problems. For clinicians in our country, the most of the camels, they are referred to clinicians for some or other problem at the time of parturition. Again, breeders were keeping one or two camels at their place for plowing, etc. Again, that has declined. And male camels, because they become very vicious during the breeding season, so it becomes difficult for the handler to handle them during the breeding season. That has also restricted the use of camels for plowing, because then the breeder, he finds it difficult to handle such camels. I'm stressing this that because we rarely come across any reproductive problems, especially for fertility problems in camel. Basically, maybe because we don't have camel herds around us, or maybe because the camel herds have shrinked, and the breeding in camel herds at our country is not very specialized. It's not very specialized. The common reproductive disorders reported in one report, repeat breeding, but I haven't come across any camel for therapy of repeat breeding. Uterine prolapse, maybe sometimes we may come across some uterine prolapse, or maybe cervicovaginal prolapse. Then dystocia, yes, camels are usually referred to referral centers for difficult births, or maybe sometimes for abortion, retained placenta, or some rectovaginal fistula, or vaginal prolapse. In another report on infertility, again by Ali and his associates, the clinical endometritis was found to be very high. But I presume the incidence of the ovarian hydrobursitis and ovarian cysts is fairly common in camels in the Gulf countries. But in our countries, because breeding is not that common, so these problems are, maybe they are not noticed by us. Maybe they are existent, but they are not noticed by us. And persistent hymen is sometimes noticed in camel heifers, and then problems of the structure of the vulvar lips, or the problems of pneumovagina, maybe vulvar atresia. Such type of problems may sometimes be noticed by the clinicians. Then vaginal affections, the persistent hymen, vulvar atresia, and vaginal adhesions. This is the second most common problem with poor prognosis. Bleeding occurs at mating. Bleeding post-mating is the usual complaint of the owner. Surgical correction with proper instruments is possible and vaginitis and vaginal tumors are very rare in the female camel. Then ovarian abnormalities, as I said earlier, ovarian cysts are common in the Gulf countries, and they create confusion with pregnancy. Even the novice person who is performing ultrasound for pregnancy diagnosis, he's not having much of expertise. He may sometimes think, because he may think that, sorry, not for this, a novice person may not find the ovarian cyst, but ovarian cyst may cause confusion for pregnancy, especially the ones which are like this, producing progesterone and making confusion with pregnancy. Then hydrobursitis is the most common problem in camels, and Chlamydophila abortus and E. coli were the most commonly isolated organisms from cases of hydrobursitis. This is one condition which creates confusion with pregnancy for the people who are performing ultrasound examination. And ultrasound examination, a novice person will think that if there is fluid accumulated in the bursa, he thinks that the camel is pregnant. And this may be many a times confusing. Surgical removal by flank laparotomy is suggested if the condition is unilateral. If the condition is bilateral, the camels are suggested to be removed from the herd, and maybe they are sent for slaughter at countries where it is allowed. The post-operative fertility is 40 to 50%. Then uterine and cervical affections. There were some, I found some reports on the cervical problems which caused the problems with conception in the female camels. And then clinical endometritis was reported in one report to be the commonest one. Then uterine lavage or infusion of the antibiotics is suggested, and pyometra and mucometra have been recorded in the female camels, although I haven't seen even a single case of pyometra in the female camel. Then abortions in camels can occur because of many diseases, and there are regulations for control of brucella, especially in the Gulf countries. Whenever a camel is brought from other place, it is tested by the immunochromatographic methods. Some plates are available. The owner has to test it, and even if it is doubtful, he will send the sample to the lab, which will perform the requisite test. If the camel is confirmed to be positive for brucella, the food authority will come and they will take the camel and do the appropriate culling of that stock. But brucella was isolated from many places in Gulf countries, and some of the countries, they have banned the entry of camels from those countries, being brucella prone. Trypanosoma evensi is one of the common reasons for abortions in the female camels, and Trypanosoma evensi, it can also result into high fever and many other problems. Sometimes twins may also result into abortion. Now, difficult births in camels. This is the reason why female camels are most of the times referred to the referral centers, especially at our center or maybe at Gujarat or Haryana. We evaluated 14 cases presented to our center in a period of 7 years. Only 14 cases were presented, and the commonest cause of difficult birth was deviation of the head and neck. You see, because of the exceptionally long extremities and the neck, the deviation of the head or the neck or the extremities are one of the commonest cause of difficult births in camels. And other causes, maybe one fetal monster, and then pelvic fracture. But the most common cause is the deviation of the head and neck. And you can see in this, very few cows were delivered live, and many a times we had to perform either partial phytotomy or cesarean section. It was dependent on after how much time the camel had been brought to the referral center. The camels brought earlier, sometimes we could deliver them even by manipulative delivery. Otherwise, but this is the picture when usually the camels are brought to the referral centers. Three legs coming out of the vulvar lips, or maybe two legs coming out of the vulvar lips. And one can even perform partial phytotomy. Professor Mehta is performing the partial phytotomy. One can also see the case like this one. The camel owners tried to handle it, and then there was a rupture of the uterus, and there was intestinal prolapse. We had to perform in emergency surgery, but unfortunately, because of blood loss, even before the animal was brought to us, the animal could not be saved. Then rarely there could be perineal lacerations, and these need to be repaired at a later time, or maybe retention of placenta. The placenta in the camel is diffuse type, similar to the equine placenta, although the camel is considered to be a pseudo-ruminant. So maybe the placenta is also one of the reasons why it is included in the pseudo-ruminant category. The removal of placenta in the camel is easy. One can just infuse some normal saline, put his hand inside, rotate it around, and then just pull it out. You can see this placenta has been removed. It is not very difficult to remove such type of placenta. And then performing the cesarean sections in camels. Some of the people, they prefer the flank laparotomy for performing the cesarean section in camel. But if you perform a flank laparotomy, initially we had performed flank laparotomy using the left flank area. But when you just enter inside the abdomen, be careful, because when you incise the peritoneum, just underneath is located the spleen. So you may cut the spleen. Then we shifted over to the paravertebral or the oblique ventrolateral approach, and then we didn't have the problem of incising the spleen during the cesarean section. The anesthetic, one can use the infiltration anesthesia, inverted L block, or maybe paravertebral nerve block, or maybe any other. But sometimes some vicious camels, they would require the administration of xylogen. And we came across one female camel which required around 60 ml of xylogen, and still it was moving around. So sometimes you can come across some very special camels requiring more and more amount of xylogen to make them calm. And then one problem with cesarean section in female camels is the poor healing of the skin sutures. Here you can see there is formation of the seroma, but it takes sometimes more than 1.5 to 2 months for the skin sutures to heal. Usually it requires at least 15 to 20 days, but sometimes in some cases it may require exceptionally, there is no infection, nothing, but still the skin sutures require a longer time for healing. I don't know, I cannot give any specific reason because we have not investigated that. I cannot give any specific reason for that. The cesarean section in camel, there are reports of performing on the right flank, on the left flank, oblique ventrolateral, paramedian. But because to us, the camels are presented very late when the fetus is autolyzed. So we usually perform it using the oblique ventrolateral approach. So thank you very much for your patient listening, and I would be happy to address any of your questions or queries that you may have in your mind. I think I have been well in time, providing you opportunity for even the questions.
Hello, sir. Hello.
Yes, sir. Yes.
Thanks a lot, sir. It's a really appreciable as well as an informative lecture. You have covered each and every aspect related to the reproductive health management in case of the camels, and I think it will be useful and helpful for all the students. If anybody have any doubt or wanna ask regarding this topic, can please ask one by one.
Yes, sir.
Yeah, pardon. Can
Sir,
you speak? Ask.
I have a question about torsion.
Yes, uterine torsion is very rare, and we came across only one case, and there was we could just palpate similar to what we palpate in cattle, but then we could not detort the uterus, and we had to go in for a cesarean section. We could not detort it by rolling the camel. It's very cumbersome to roll the camel also. Being a very large animal, it is very difficult to roll the animal even after administration of xylazine. And we had to opt cesarean section for that.
Sir, also, if in case of early abortion, do we also just give a PG2 alpha?
Abortion for inducing abortion or
Inducing abortion.
yes, the camel CL are responsive to prostaglandins throughout the gestation,
Okay.
similar
Thank you,
to
sir.
cattle and goat.
Thank you, sir.
Okay.
Anybody
Excuse me, sir.
have? Yeah.
Hello.
Yeah, sir is listening. Can you please ask about your doubt?
Yeah, sir. Like in cattle, we mate about 12 hours after seeing the signs of heat, like mounting on other cows. But in camels, is it necessary to go for ultrasound to measure the diameter of the follicle?
You see, it's not at all essential. But if you are working with a farm, then of course you will have to go in for evaluating the diameter of the follicle. But at farmers, breeders which don't have access to ultrasound, again, when you need to use ultrasound, you will have to restrain the camel, give xylazine, and then examine by ultrasound. So it's not necessary. Breeders usually, what I said at the earliest of my talk, that breeders usually think that any time during the breeding season, you can give a mating and animal will become pregnant. Many a times this is correct, at other times this is not correct, because the follicular growth is a continuous process during the breeding season. Even in the presence of a CL, follicle growth is continuous, and ovulation will occur only in response to a mating if the follicle size is from 9 mm to 20 mm. So one can opt without ultrasound also. It's not that necessary.
And sir, is removal of pole glands a normal process in castrated males?
No, castrated males, pole glands, they need not to be removed, because the pole gland secretion will decrease once you castrate the animal, because pole gland secretions are governed basically by the testosterone. Even pole gland secretions have high amounts of androgens.
So one more question.
Yes, yes.
In bovines, we can practically check if a pregnant is if an animal is pregnant or not by checking the ovaries and if there's CL present.
Yes.
Can we also in a camel? Can we also reach the ovaries and check if correctly if a camel is pregnant or not?
Yeah, yeah. It's similar to cattle. For maybe at 45 days, you can easily differentiate a pregnant and a non-pregnant camel. I have particularly done this. So it's not that difficult. It's not difficult.
Like correctly.
Yeah, yeah.
Okay, thank you, sir.
Okay.
Anybody want to ask more questions or having any doubt regarding this?
Excuse me, sir.
Yes.
Yeah.
Sir, like you have mentioned earlier that we can increase the amount of xylazine to 60 ml. Will it have any negative effect on the animal?
Particularly in camels, no. It will not have any negative effect. It will increase the salivation, but not to the extent it affects the buffaloes. In buffaloes, if you give xylazine more than 1 ml, you will have a lot and lot of secretions and you will be at problem. But not similar in camel. It
Thank
is
you,
a
sir.
routine. It is a routine for camel breeders to give 2 to 5 ml of xylazine for examination of the camels. Sometimes even 10 ml of xylazine. So,
Sir,
yes.
sir, as you mentioned the runt season. So in the runt season, it's more the camel is more prone to tongue problems.
Yeah, because it becomes very aggressive. And the very common problem with the mouth of the camel will be the dental fracture.
Okay. So
Because
any particular disease that which it is more prone to?
no, disease it is not prone to, but it is prone to dental fracture, mandible fracture.
Okay.
You can send me your queries also later also at my email gnpobs@gmail.com. The simplest one. GNP is my name, OBS obstetrics@gmail.com.
Thanks a lot, sir, for responding all the queries and for this informative lecture. And we will be in touch with you and will require more and more services as and when required in future. Thanks a lot, sir. Thank you.
Okay.
Thank you.
Sat Sri Akal.
Shikal, sir. Okay.